Hello, my name's Thomas Gray. I'm one of the Obs and Gynae trainees in Sheffield, and I want to talk to you about the development and production of a novel smartphone app which you can use to collect day-to-day feedback from doctors in training and from their trainers. This project's been ongoing now for about a year and a half, and it's been supervised by Professor Tom Farrell. I'm going to start by talking about some background about feedback on perceptions of training. And then I want to talk about the development of the app briefly before showing you how the app works, what it does, and what it can be used for. So first of all, with regards to background on feedback on perceptions of training. So trainees, doctors in training, provide feedback on an annual basis via the National Training Survey, which is distributed by the General Medical Council. And they also provide feedback usually to their local deanery or Health Education England authorities, they're now known. That feedback is collected on an annual basis, and usually it's provided at the end of the placement year because it's collected in the summer months. Any changes implemented as a result of that feedback usually don't affect the cohort of trainees that have provided them, as they usually rotate to a different hospital or placement. Therefore, the National Training Survey and the sort of local feedback surveys don't often benefit the trainees that have provided them the feedback directly. The second thing to think about is the feedback that trainees are provided with regards to their performance. The feedback that's collected about the trainee's performance in terms of 360-degree feedback. That's collected at the moment twice a year in the form of a TA1 and a TA2 assessment. Usually only 2 or 3 consultants each time complete the TA1 and TA2, and that may not always be very representative of who the trainee is. So there are several problems with the current system. Give you a bit of background about smartphones and apps, just so you're fully aware of the situation. So a smartphone is simply a mobile phone with a more advanced computer processing capability and connectivity than traditional mobile phones. They usually have they usually have touchscreen technology, they usually have internet access, and you can run custom-built software applications or apps on them. So for example, the Apple iPhone is probably the best-known smartphone. Things like the Google Nexus, Samsung Galaxy, HTC One, Amazon Fire phone, these are all smartphones. Ownership of smartphones is very high amongst UK doctors, and there's evidence showing that 85 to 90% of UK doctors own and use a smartphone in their practice. The two commonest platforms for smartphones is the Google Android system, which you can use purchase apps on the Google Play Store, and Apple iOS, which you can purchase apps on the Apple App Store. So why do we need a smartphone app for providing feedback on training? Well, I've already mentioned about the frequency with which feedback is provided by trainees about their training experiences, and also the frequency that the trainee's performance in a session is criticised by trainers. So first of all, doctors in training and their supervisors or trainers are busy. Providing feedback is time consuming, so those two things are in direct conflict with each other. We've already said that most doctors own and use a smartphone or a tablet device. These devices are quick to hand and instant to access. And if you have a smartphone app that's specifically designed for providing feedback on training from both a trainer's and a trainee's perspective, that's likely to be easier to use than the current systems that are in place, which usually involve logging onto a desktop computer. So what did we want this app that we were planning to develop to do for trainers and trainees? Well, first of all, for trainees, we wanted trainees to be able to record feedback on their perceived value of the educational content of a session, so for example a clinic, a theatre or an on-call, and that would include their perceived value of the educational and clinical supervision they'd received. We wanted it to be possible for them to do this after each session that they completed. With regards to what we wanted the app to do for the trainers, we wanted the trainers or supervisors to be able to record feedback about the trainee's performance after each clinical session. So there would be very frequent recording of the trainee's performance throughout the year. Crucial to both of these, we wanted there to be a good content management system, which would allow the data that was generated from the feedback provided by the trainees and the feedback provided by the trainers to be analysed so that we could look at it by trainee, and we could look at it by trainer, so we could see patterns and trends in relation to everybody else working in the department, so we could see who's performing well and who needs more help and support. We also wanted the system to be able to provide a simple printout, which would be able to provide a summary, so it could be used simply at ARCPs and for appraisal. We also want the content of the app to be completely modifiable so that it could be modified for other specialties and disciplines. I'll just briefly explain how we developed the app. Well, before I do that, I'll just talk about what we wanted the app to do for trainers and trainees, actually. We wanted the app to be able to record evidence of your clinical activities every day, which you could use for purposes of appraisal and revalidation. You could use it if you're a trainer, for example, to provide evidence of clinical and educational supervision that you provide. We also wanted to have a logbook in the app so people could record practical procedures that they were involved in, both trainers and trainees, again for purposes of appraisal and revalidation. And we also wanted the app to have a function for providing a simple way of collecting patient and colleague feedback compared with the systems that are already in place. So in terms of how we developed the app, we went through a process of literature review, and we looked at literature. We confirmed that through searching Medline and PubMed and Web of Science, and also by doing hand searches of the app stores, that an app for providing feedback on medical training is a new concept. So we developed the app simply by making advanced paper-based versions of it. We made pro formas for different clinical areas for both trainers and trainees, and we found a logbook app that was available on the Apple App Store, which could be modified, and with permission we modified the content that we had developed into this app. We then went through 3 pilot phases, refining the app at each stage and collecting evaluation and feedback from the people that were using it. Once we were satisfied that the app was working effectively, we went through a formal professional software engineering process, which has been funded by Sheffield Teaching Hospitals, and the app, which is known as Healthcare Supervision Logbook, is now operational. So what I'm going to do now is just show you Healthcare Supervision Logbook, what it looks like, how it works, what it does. So this is what it looks like when you turn it on. As you can see, it is secured by username and by PIN number. So you use the content management system to set up a new user. You apply a department to them, which they can alter later on if they rotate round. But it is secure, and you only need to put in your PIN number once you've logged on once, so it's very quick to get onto. There are 2 versions of the app. There's a version for trainers and there's a version for trainees. This is what the menu looks like, the main menu. So you can see there's 4 menu items if you're a trainer. There's a logbook, sessions, training, and patient or surveys, as that's going to be known. If you're a trainee, there are 3 versions. You don't have the training version, you just have logbook, sessions, and patient. The sessions section is used by both trainers and trainees, but is used in a different way. So this is the part of the app which the trainee can use to provide feedback on their perceived value of the educational content of a session that they attend, including their perceived value of the educational and clinical supervision they receive. So when they attend a session, so a clinic, a theatre or teaching session, or a lay ward session, for example, they're able to provide feedback on their session, so whether the session started or ended on time, whether they received feedback in the session, whether it was useful or not, whether they were offered work-based assessments or not, whether there were any incidents in the session, whether any undermining occurred in the session. Currently we have this anonymised for trainers, so when the trainee goes on the system, they select a trainer, but at the moment they just select blank or anonymous. But you can use this so it's trainer specific, so that when the trainee has a session, they select who their trainer was, so that feedback is logged against a trainer. It's possible to anonymise that, and that's what we're doing for the time being. I'll just show you a version of this, what the screen would look like, for instance, for a feedback from a theatre session. So further up the screen, they will have said whether the session started or ended on time, the number of minor cases performed, the number of major cases performed, whether the surgical training was affected by complications, time pressures, or a consultant decision, whether there was time to see the patients post-operatively, whether they were undermined in the session or not. And whenever a trainee reports undermining, they need to say whether they took action, so whether it was reported or not, and if they were undermined, who was it by, so by a consultant, a senior trainee, a junior trainee, a midwife or a nurse, for example. They can also write a comment or a note for each session. It's essentially a soft way of reporting undermining, and it can be used to detect patterns. And basically, if the trainee reports that they were undermined but they haven't reported it, they're emailed automatically a copy of the bullying and undermining policy for the department, so that they can be informed about that process. This again is just a quick screenshot of the menu. So we've talked about the sessions section. The way actually to mention that the trainers use the session section. Trainers simply use the session section to record their clinical activities. They have a pared down version, so they're obviously not saying whether they or offered work-based assessments, for example, where they received feedback. They just record the number of patients that they've seen or the number of cases that they've done. They can record undermining, and they can record a comment about the session, and that's simply for collecting evidence for appraisal and revalidation, and for their own benefit, for keeping a record of the clinical activities that they do. So moving on to talk about the training section of the app. So this is only present in the trainers version. The trainer selects a trainee from the menu, so this is obviously not anonymous. It's completed after each session to provide feedback about the trainee's performance during that session. And over time, this effectively provides daily multi-source feedback about the trainee's performance. So this is an extended screenshot showing 3 screenshots of the pro forma that is filled in by the trainer about the trainee. So for example, this is in theatre. They can say whether the trainee was punctual or not, whether the case mix was correct for them or not, whether they had work-based assessments completed or not, whether they were provided with feedback or not. And then we've got visual analog scales on a 5-point scale, which we've borrowed from the TO1, TO2 system, which basically means that they can rate the trainer. The trainer can rate the trainee for things like empathy and respect, team working, verbal communication skills, insight and clinical judgment. So essentially, this over time provides multi-source feedback from lots of different people who would who provide feedback about that particular trainee in their different sessions. I'll show you the logbook section of the app now. The logbook section, basically, at the moment, it contains all the procedures that we do that are relevant for obs and gynae, but you can change it for different specialties. So, for example, if the anaesthetists want to use the app, they can create their own logbook, which will be specialty specific. All of the entries are time-stamped, and you can record the level of supervision you've had and any complications that have occurred. There's also an option to add a video link to aid reflection, and we think this is a very useful thing. So, for instance, if you log that you've been involved in a shoulder dystocia, there'll be a link to a video where you can watch a gold standard management of a shoulder dystocia, which can then aid your reflection. And that's a very good way of putting links to guidelines and links to videos and resources for trainees and trainers alike who are using the app. This is just a screenshot of the logbook section, so you can see they've selected labeled skills and they've picked off fetal blood sampling here. You can say whether the level of supervision they had, whether there are any complications, and write a comment or a note about it. And again, this is very useful for trainers to keep a record of what they do in terms of activities for purposes of appraisal and revalidation. Moving on to the last section of the app, which is patient or surveys. Simply, you can use this to send a survey out to a patient or a survey out to a colleague to get feedback on your performance. And we've currently used the GMC surveys, which are on the GMC websites, for collecting patient and colleague feedback for purposes of revalidation. So these are the correct surveys to use. This is a screenshot of that particular function. You simply put in the name of the patient or colleague, and we've actually removed it for patients, so it's anonymised. You put their email address and you send them a feedback form. So the main take-home messages of the app are that it has these 4 sections. It has a section for sessions, where the trainee can provide feedback on their perceived value of the educational content of a session, including their perceived value of any educational clinical supervision they've received. There's the training part, which is used by the trainer to provide feedback on the trainee's performance. And there's the purposes of the app to collect records of what you do for purposes of appraisal and revalidation. So the session's content is useful for the trainees and the trainers alike to record their activities, and obviously the logbook section and the patient section for collecting patient and colleague feedback, and the logbook section for collecting records of your clinical activities are very, very useful. The main take-home messages are that the app can be used to analyse feedback about a trainee's performance over a period of time. You can use the content management system to generate a report for a particular trainee, so you can see their performance. You can compare that performance with other doctors in the department, see how they're performing. You can also use this to collect feedback about a particular session. You can look at to see how the trainers are performing within a particular department and highlight areas for development. Recording of activities and patient colleague feedback is obviously very useful, providing evidence of education and clinical supervision for appraisal and revalidation. But ultimately, the purpose of the data that this app collects is to improve the training programme via pattern recognition, and it can be used to support good practice. So it can be used to appraisal and ARCPs to say this person is performing well, or it can be used to highlight areas for development as well. We think it's a very useful system, and we think that it's going to really improve the way that we assess trainees and the way that we assess the educational and clinical supervision that they're being provided with. So thank you very much. We'd be very happy to answer any questions that anybody's got about this. Thank you.